All right, welcome to Life Extension Live. I'm your host, Dr. Mike, and I'm here with Dr. Crystal.
Hello.
And obviously you can see that we have a special person on. We're going to talk about acupuncture today, and we're really excited. Stay tuned because we're going to do some demos. Mm-hmm. Dr. Crystal's going to get a facial or something. I don't know what's going on. So stick around for that. Acupuncture is a very important topic. We definitely enjoy talking about it. So we have with us a special guest today, Dr. Ahuva Gamliel. She's a naturopathic doctor, right? Number one, you also are an acupuncture physician from Bastyr University. You've done all kinds of stuff, right? We're really excited to have you back on. We did a great podcast with you. It's doing really well, too. If you want to check that out, that's liveforeverish.com. Welcome to the show.
Thank you so much.
So big question. I'm a conventional MD, big old style stuff, right? Mm-hmm. You said kind of quick.
Old style stuff.
I want to know, and I think a lot of people want to know, what is acupuncture, but ultimately, what is it doing?
Yes.
How is it working?
So that's a great question. So according to traditional Chinese medicine, we have meridians, which are channels of energy on the body, as well as different acupressure points. And what happens is when the energy gets stuck, that's when we start having health ailments. It could be mental, physical, or emotional. Mm-hmm. Things like depression, anxiety, body aches and pains, headaches, etc. So what we do with acupuncture is we insert the tiny little needles into different pressure points, and what that does is it facilitates the free flow of energy, which is known as qi, and blood in the body. And it's really the blood and the moving of the circulation that helps with the healing, because as you know, the blood contains the white blood cells, which are the body's defenses, the body's immune system. So we're basically telling the body to bring attention to a certain area that needs healing.
Okay.
Wow, so there is a science to it, which makes sense.
But if I'm unstuck, I'm okay. Circulation's good. I just want to make sure I get this.
But you get stuck to get unstuck.
But if I'm stuck, there's maybe some I'm not getting enough nutrients to an area.
Correct.
I know there's different ways of saying that, energy and stuff like that.
Yes.
But for me, again, being the oof, to me, it makes sense that I need to get some inflammation to that area. I need to get nutrients.
Exactly.
I need to get immune cells.
Right.
And that's kind of what the needle is helping with.
Exactly.
Is it helping with the lymphatic flow?
Yes, it helps on so many different levels. It helps to relieve muscle tension. It releases serotonin from the brain, just like exercise, so people feel more well-being. Mm-hmm. So an example is like with depression, people are still facing the same challenges in life, obviously, but they can approach it in a more calm, cool, and collected manner because they have those neurotransmitters working for them,
Right, and so you were on our podcast, as Dr. Mike mentioned, and something I learned was that it is covered by health insurance, and I found some other facts.
Nice.
In the state of California, it's now considered essential health benefits, and more than 10 million acupuncture treatments are administered annually in the United States. So. Wow. Thank you for the work that you're doing.
Very good,
and I'm curious as to the types of people that you're seeing most often. When people are coming in to get acupuncture, is it primarily pain? Because I've read that that's kind of the main focus.
Correct, yeah. Most people know about acupuncture for body aches and pains, for various pain conditions. It could be sciatica, migraine headaches, neck pain, shoulder pain, knee pain, any kind of joint pain. However, as I mentioned before, acupuncture can be used for mental things like stress, depression, anxiety. It can be used for digestive disorders, hormone balance, infertility, really anything from head to foot, any reason why a person would see their primary care provider. Yeah. They can also utilize CAM, complementary and alternative medicine, and acupuncture falls under that umbrella to treat their condition. And you mentioned California, so here in Florida, acupuncturists are currently considered primary healthcare providers, and we can bill insurance. However, our license is under attack right now. There's currently a bill that they're trying to pass to eliminate our title from being physician and doctor to just acupuncturist. So we're really hoping that doesn't pass. And so for any listeners out there who are like to take part part in politics and you're in Florida, you write to your representative and you let them know we want our acupuncturist to maintain the doctor title, because as such we can order blood work, diagnostic imaging, and we can bill health insurance, and we can help so many more people gain access to this type of medicine which they might not have had.
So losing that title would really affect how you practice at the end of the day.
Absolutely,
Yeah, so
yeah.
very important if you're in Florida. And is Florida the only state? Are there other states doing this, or right now is it you just know of Florida?
I just know Florida right now,
Okay,
yeah.
all right.
So going back to CAM, complementary alternative medicine, do you find that you're able to really partner with other, primary care physicians that may refer to you, or people are kind of contacting you and seeking you out individually? Do you find that it's more of a partnership, or
Both.
doctors, the other doctors, the general care practitioner, the family medicine doctor, they don't know that their patient is getting acupuncture?
Sometimes they don't know, sometimes they do. I
So
think. Yeah.
that's part of the reason why I think that our title is being attacked, is because with complementary and alternative medicine, we help the body to heal itself. With the conventional medical model, they're using, a lot of pharmaceutical drugs and procedures that kind of suppress the symptoms, and the patient doesn't necessarily heal. So sometimes alternative healthcare providers, such as homeopaths, naturopaths, and acupuncturists, they see us as a threat to their medicine, and they try to suppress us. Like, there used to be homeopathic medical schools in America, but the AMA, American Medical Association, shut them down
knocked those out.
because it was a threat to their pockets.
Yeah.
So that's kind of what is happening to my profession now as an acupuncturist, is because it's so effective and it's working, and people are using insurance to go see their acupuncturist, they want to keep that money in the pool for the non-acupuncturist.
Right.
Happened the same thing with the personal injury insurance, where acupuncturists used to be able to help people after they had motor vehicle accidents, and now that was eliminated. And so unfortunately the medicine is being kind of like taken away from the people, but
Yeah.
we got to say stop.
Yeah, absolutely. I think that I agree. And I think more and more conventional doctors are, especially the younger ones, coming
Well-
up are more into that. But listen, we got demos coming up. We got a bunch of stuff to do.
I know. I just
But-
have one more question.
But I have another question too. Go ahead. You go with your question.
I want to know, do you think they have a case? And if not, tell us about the research that would just kind of debunk all of this.
Good question. Yeah.
It's not something that should be essential.
Right. So their basis is misleading the public. Kind of, they don't want us to be seen as doctors. They, the reason why they took away the PI, the personal injury insurance, was because there was a lot of fraud, but it wasn't necessarily by the acupuncturist. I mean, all of the insurance industry and in the medical field, there's a lot of potential for fraud, for overcharging and things like that.
But I want to get back to like more of the research. What does the research show us related to acupuncture?
Okay, so the research shows that acupuncture is proven to be both safe and effective in treating over 40 different conditions. And that's not me talking, that's the World Health Organization. Okay, so unfortunately, though, insurance companies only cover about half a dozen or so conditions.
Okay.
Usually it's migraines, headaches, neck pain, low back pain. It can be used as a treatment for the side effects of chemotherapy and radiation for cancer patients, and a couple of other things, like as an alternative to anesthesia during surgery. But
Wow.
Now,
Yeah.
Perfect.
Dr.
I
Mike.
don't know about that one.
yeah. Oh, that you know what? That brings up a good point. We talked, I think, last time maybe about placebo effect and how that might come into play. So how do you know that acupuncture works? Well, the fact that it works on animals and children. There are veterinarians that do acupuncture on horses and other animals.
Yeah.
And the fact that a horse has acupuncture and then it can get up and run, it tells you that it works, because the horse is not thinking, oh, I just had acupuncture, I should be feeling better.
Yeah.
Well, I have a perspective on the placebo effect.
Okay.
I don't really care, Dr. Mike.
Well, I mean-
if it works, it works.
Yeah.
Right?
Yeah, I
At
mean-
the end of the day,
Yes.
if the patient feels better, if before they were walking and limping and couldn't squat down and now they can,
Yeah, but it's
What do you
also
think?
but it's also about lasting effect and stuff like that too.
Yeah.
So it is important to measure against a placebo.
Correct.
But I've seen that with chiropractors, like with dogs and horses. It's the same idea.
Exactly.
There's really no placebo with them.
Right.
I want to go back to what you have here.
Yes.
All right. You got an ear and you got a body, and again,
Yes.
you're talking about unclogging, opening up energy. So you're not just taking a needle and just saying, "Oh, I think we got to stick it here." I mean,
No,
there's
no.
there's science to this
Yes.
as well. Tell us a little bit more about what we're seeing here.
Right. So first of all, acupuncture is a 3-year master's degree. We do have to have a bachelor's degree in a medical science, such as biology, chemistry, etc. Mine is in psychobiology, psychology, and biology.
Okay.
So first, we have to be pre-med. And then it's a 3-year master's degree. I also trained in Chengdu, China, where they have a teaching hospital where they're doing
Oh,
Eastern
wow.
and Western medicine
Very
side by
nice.
side.
Nice.
Yes.
Wow.
Yeah, it was a really unique experience. We had 4 students for every doctor and a translator. And we got to
Wow.
see, the patients receiving the best of both worlds, so to speak, Eastern and Western medicine.
Very nice,
and
yeah.
and the results were amazing. So I brought with me a model of the ear. You mentioned massage therapy before. So acupuncture utilizes pressure points on the ear as well, and the ear has a map of the entire body. So just like the palm of the hand and the foot are a system of reflexology, the ear is as well. And so what you can see here is an upside down person. And so, for example, if somebody has
Wait, show that a little bit more. Can you get in on that, Hannah? An upside
it's a
down?
little-
Because it's a little
Upside
hard.
down. Oh,
I see
there's
it
the
from here.
upside down person.
Yeah,
it's here.
yeah. See that? There's a person
It's hard
within
to see
the
with
ear. Okay, and that's connecting all the anatomy
Yes,
points.
it's called
Okay.
the homunculus, and we have it on our brain as well. So, and the interesting thing about the ear is it can be used for diagnosis as well as treatment. So, for example, somebody might be coming into me to see me for knee pain, and then I notice that there's a tiny little blood vessel on the lumbago point, which is low back pain. And I asked them, by the way, does your low back also bother? And he said, yes. How did you know? Well, your ear told me.
You see, right there, a lot of people were like, wait a second. But it does work at
Yes,
the end of the
it
day,
does.
right?
Yeah.
To your point, it works.
So we also have in the middle of the ear all of the internal organs of elimination. So we do detox treatments in the ear. There's also, I don't know if you can see this, but appetite control point. So for weight loss, we do appetite control as well
right
as
there, we need it
stomach.
Where
right
I
there.
need it.
Crystal, grab
I
that.
know.
Let's start.
Maybe
Massaging, yeah. And then point 0 is kind of a reset point, and Shen Men is one that I do a lot. It's for anxiety, depression, stress, and insomnia.
Okay,
So that's one.
amazing. Now let
Wow.
me now this isn't just this has been known for millennia,
Yes,
really, right?
correct.
This isn't like something you've come
It's
up
not
with
new.
in the past
No.
like decade.
And that's another thing where people say about acupuncture when they're testing, like, how do you know that it works? Well, it stood the test of time. It's been around for thousands of years. So if it didn't work, if it was not safe and effective, it wouldn't be around
it
today.
would have dwindled out.
Exactly.
Yeah, it's people would have stopped
Yeah.
getting it right at the end of the day.
Exactly.
Before we move on to the demo, you wanted to share like one of your favorite experiences or something,
Yes,
right?
yeah,
Tell us about that, and then stick around. We're gonna get some stuff done.
Yeah, we'll also do,
Some stuff.
since you mentioned that you liked the weight loss idea, so I'll also put the pressure points on your ears if you'd like. These are vicarious seeds, which is an herbal plaster. It has kind of like a Band-Aid type of thing, and then you put it on the pressure point, and then you're able to massage it on yourself by rubbing it for 10 seconds, like 3 times a day. They usually last for 3 to 5 days. However, they can last up to 2 weeks if you have dry skin, and that helps to reinforce the treatment.
But that's appetite type stuff, right?
It could be for anything. It could be for weight loss. It could be for detox. It could be for relaxation, body aches and pains. This is the part for the spine. So quickly before we go to that memorable story, I just want to also mention
Sure.
the suction cups. So sometimes people are needle phobic and they're shy to get acupuncture. So there are other things we can do. I have a little device that can stimulate the pressure points without any needles, and we also do suction cup therapy. So these are suction cups that are used on the back. That's why they're bigger, and I just use this to like draw the air out of it. And then it pulls the skin up. I'm sure you've seen like
I've seen it.
Michael Phelps and other
Yeah.
people with these like bruises on their back.
Yeah, it looks pretty extreme. when
I
you see
know.
the
It
pictures.
It's
Yeah.
pretty hardcore, but it really helps to separate all of the levels of the tissue, like the skin, the fat, the muscle, all the different layers, and it really helps to relax the muscles and like bring everything to.
And the flow gets better,
yes,
right? That's
exactly.
because I keep going back to that,
The
right?
lymphatic flow, the lymphatic drainage,
The
blood flow, the
circulation, lymphatics.
exactly.
That's key to overall
To
health.
healing,
right?
yeah,
Right.
absolutely.
Okay.
Yeah, and then we have the smaller cups for like smaller areas, so you could see it's
That's
like
probably
stuck
more
there.
my cup. So.
And you could do these on face also
Yes.
for facial rejuvenation.
Oh,
Okay.
jeez.
Okay, so back to your question.
Yeah.
So my most memorable case. So my first job when I finished acupuncture school was doing acupuncture on a cruise ship. And the way that we would get people to know about our services is we would give free lectures on sea days. So people would come and they would get educated because, as we said before, most people think about acupuncture just for body aches and pains, and they don't think about it for incontinence or other internal things that they could see a doctor for. So a lady came in and she had reflux, and she was taking medication for it. She had 3 acupuncture treatments, and then she said she no longer needed her reflux medication. She was ecstatic. So she said to me, I'm going to send my husband to you. He has shoulder pain. He's not going to tell you this, but I'm going to tell you he also has erectile dysfunction, and I want you to treat him for it. So she was right. She sent her husband in, and on my intake form, he did not check off the little box for ED. This is something that a lot of men are embarrassed about. So I gave him the treatment, and there's points on the ear as well as on the hands and the feet that stimulate circulation and boost vitality. And so he knew that I was giving him a treatment for his shoulder. And she came to my office a few days later, and she said to me, "What did you do to him?" And I said, "What do you mean?" And she said,
That's
"I
great.
feel like we're on our second honeymoon."
That's awesome. Well, there goes that
Yes.
placebo effect.
Yeah, he's kind of like the horse. He didn't know.
He didn't know.
Great.
He didn't know.
Oh,
Right.
fabulous story. So now we're going to do a demo. We got our demo station over there. So let's go for it, right?
All
You
right,
ready? Here we go.
let's
All right, so we're coming into our demo
Oh,
area.
this is exciting.
I've never had acupuncture before. I'm really excited about this, Dr. Crystal. You've had one treatment
years
before.
ago.
So I think we're going to start with me, right? Apparently, everybody here believes I need to calm down and have better mood. So we're going to do something with my mood in my hand, right?
Yes.
So just kind of walk us as you're doing everything. Just kind of tell us what you're doing and where should I put my hand.
Absolutely. Just rest your hand right here. Just relax it, natural, and take a deep breath. Yes, breathe into your belly, relax. Okay, so the first thing I do is I take some rubbing alcohol and I swab the pressure point.
Okay.
And I do explain everything that I'm doing in my clinic as well, when I see patients. So there's no surprises.
Okay.
I
So right in this
I don't
area.
just sneak up on you with a needle.
Yeah.
So these are disposable stainless steel needles. They're used one time and they're thrown away. They're in the biohazard here. They're not autoclaved like they do in China. They reuse the same needles.
Right,
Oh,
okay.
wow.
The same people.
Okay.
But usually people, like my experience in Chengdu, China, was that people had their own like Ziploc with the needles that were
That's
used
so-
on
that's-
Oh,
them.
my little zippy. And
That's
I bring
so
my
funny.
So
People-
needles with me.
recycling. Yeah.
Okay.
Okay.
Now, why that spot?
Okay, so that spot is called large intestine 1. It is what's called the panacea point, which means cure all. It's the main mover of qi and blood in the body. So anytime the energy is stuck, this point is utilized to move the flow of energy and qi.
Okay.
So this point is excellent for headaches. So if you have a headache, you can massage it on yourself, do acupressure on yourself. Any body aches and pains, menstrual cramps.
Menstrual cramps.
Yeah, all kinds of
What
things
about like
that.
constipation and stuff?
It can be used for digestion as well, yes.
So maybe I'll have to go to the bathroom.
Nice.
Oh yeah, it could. It could help you go to the bathroom. Okay, so then I use this plastic guide tube, and you're gonna feel the guide tube on your skin, and then I'm gonna gently tap it in as you exhale. And so once the needle's in, it's normal to feel a dull, heavy achiness or pressure sensation. That means that it's working.
In my hand?
Yes,
Okay.
and your arm. See, if you were laying down on a massage table like we were doing a full body treatment, you might feel like your arms were so heavy like you couldn't lift them off
Oh,
the
wow.
table. But you really can, but it's just that
It's that,
sensation.
okay, and that's normal to
And
feel
that's
that.
normal.
Okay.
And usually the
Okay.
needle would be left in
I'm a
for
little
half an
nervous
hour.
now.
I was
I
gonna
know,
say, are you
I'm like,
nervous?
wait,
Do you
what's
need me
going
to
on?
hold your other
Am I really
hand,
going to have to go to the
Dr. Mike?
bathroom?
Do you
No,
need me
not
to-
during the treatment. Maybe after. It's not.
okay?
But that's a good question. Like, how fast do you notice it? So if I was doing, for example, a sinus treatment, sometimes people notice within 20 minutes, oh, my sinuses are more open, I can breathe better. Or if you had a migraine right now and I did a migraine treatment, you would say, and I actually had this experience with a patient. The entire time that I interviewed him, his eyes were closed because he had the photosensitivity that comes with migraine sometimes.
Yes.
And then in the middle of the treatment, he opened up his eyes and he said, the light doesn't bother me anymore.
Okay, so it can be pretty quick
Yeah,
for
it
some.
can
Okay,
be, yeah.
all right. But I guess
All right.
everybody's a little different.
Exactly,
And, stuff.
and it depends what's going on, how long you've had it, so many other
Gotcha,
factors
okay.
like we talked about before, nutrition, hydration, exercise,
Yeah.
it all
Okay,
affects.
I'm ready.
Okay.
All right, let's get him calmed
So,
down.
Yeah, so breathe into your belly
It's okay.
and then exhale and release. And that's it.
Oh, she's a pro.
I didn't feel
Look
a thing.
at that.
Yeah.
Did you fit nothing?
No.
So
Don't
there is
move your
there is
hand.
yes, that's right. Because if you move your muscle, you move the needle, and then it could be uncomfortable. Now,
I'm not moving nothing.
so there is a technique where you twirl the needle to get chi. Then you'll feel a tiny little muscle contraction, but the treatment will be a little stronger. Would you like me to do that, or are you good without the
I think
twirl?
I'm good right now.
Without the
I'm not sure about no twirly thing. We'll skip that.
Okay.
Maybe that'll be part 2.
Okay. And do you want to see what a suction cup feels like?
Sure. Yeah.
Okay.
Now I do think I've seen that twirly thing on TV before.
Yes, where they just
Yeah, it was
lift
kind
up
of like
and
they're
twirl
doing.
it.
Yeah, I've seen that.
I've
Yeah,
never
That-
seen
it,
that.
it looks
Yeah.
pretty intense, actually.
Yeah,
Okay.
it can be.
No,
but
no twirly.
You feel all of a sudden like the chi grabs the needle and then it's just like, whoa, for 1 second and then that's it. But anyway, so this is just the suction cup to see what it feels like. It's
Well,
kind of hard to do
I
that.
used to do that with vacuum cleaners. My brother and I used to fight with them. That's what it
Oh
feels
my
like.
goodness. Yes.
Yeah. We used to give ourselves hickeys.
Oh my
These
goodness.
things will do the same thing. So, and then did you want to do the ear seeds?
Okay. Now you're not going to do a needle first? Or
No, just do the ear seeds.
Okay.
You're right-handed, correct?
Mm-hmm.
Okay. So,
So again, remember this. You put that on. I can rub it, and I'm
Yes.
going to get some of that same
yes,
effect. Okay.
yes. So, what kind of treatment would you like for stress
Let's-
reduction or?
Let's do the weight one because
Okay.
I'm losing weight right now. So
Okay,
that'd be great.
cool. Okay, so the first point is for appetite control. So it's right here. You massage it for 10 seconds 3 times a day,
Oh, that feels good.
or whenever you feel like you shouldn't
That
be
makes
eating.
me sleepy.
Do you do intermittent fasting?
No, I'm low carb.
Oh, low carb. Okay,
Yeah.
good.
Yeah.
Whatever works for you. There's
Yeah,
there's so many different ways to diet.
Yeah, no. At the end of the day, it's you know what it is really. It's I'm moving more and I'm eating less.
Okay.
That's what it comes down to. Yeah.
Good. And this one on the inside is for the stomach.
Oh, that's kind of ticklish. Okay.
Okay.
And then I just every once in a while rub them.
Yeah. Yep.
And then in about 3 or 4 days these fall off.
Yes.
Okay.
Yeah. They can last up to 2 weeks, as I mentioned.
Okay.
Now, with the treatment that you're doing with Dr. Mike for his stress, how
Yes.
long will that last?
Oh.
The effects?
So the effects of the acupuncture last in your body for about 72 hours.
Okay.
So when
Not that long.
so when a person first starts getting acupuncture, it's recommended that they come a couple times a week. Then as they start getting better, space them out more and more.
Okay.
You know, for example, a lot of insurance companies will give people between 10 to 30 sessions of acupuncture per year. So
Okay.
you can
Okay.
stretch them out.
So now I just sit like this.
Yep. You just relax. Yep.
Okay.
Your turn.
Now, my turn.
Yes.
I think I also want a few of those,
The ear seeds.
the ear seeds,
Okay.
yes.
Yes. Okay.
You're gonna have a whole bunch. She wants stress, weight,
Let me
appetite.
tell you that my list was long, but of course I know we only have a short amount
Her
of
whole
time.
ear's gonna be covered with these seeds.
Yeah.
Okay.
Okay. So, do we want to do the facial rejuvenation?
Yes,
Okay.
yes.
So we're gonna do a point between the eyebrows, which is like a natural alternative to Botox.
Okay.
So the acupuncture helps to stimulate your body to produce more collagen.
Okay.
And you don't need it, but it's preventative as well. So it's
Right.
good for maintenance and prevention.
Okay.
And anti-aging.
Okay.
This point has a lot of health benefits as well, as it corresponds with the pituitary and the pineal gland. So
Oh,
it's a
good.
yeah.
So I should be sleeping well tonight,
Yes.
sleeping better?
Yes, yes, yes. And it's also good for the vision.
Oh, there you go.
I need that.
Geez, everything.
Some of you may have seen me on shows with my glasses on a couple of times, but they're pretty
Okay, well,
thick.
let's see now. I'm
Are you wearing
curious.
contacts?
I do.
Yeah.
Yes, I wear contacts.
Okay, now be careful. Get ready.
I'm ready.
Your head's gonna feel heavy. You're not gonna be able to lift it
I
up.
am ready.
Okay. All right, so I'm just going to swab the point first with a little
Okay.
rubbing alcohol.
All right.
Okay. And then I'm just going to grab
So
the
I'm
area.
gonna
Yes,
close my
relax.
eyes
Yeah,
and
just
relax.
breathe.
Don't
Look at that. She didn't
don't hit
even
her
flinch.
brain.
She didn't even flinch. She's a pro.
Oh, that was you already did it.
Oh,
Look at
I mean,
that.
really? Okay, I should probably not
What?
move my eyebrows in my
Yeah,
face.
don't lift up your eyebrows. Yeah, correct.
Okay.
But I like how you're like in this meditation state. When you have acupuncture, your body is in a state of hypersuggestibility because you're so relaxed. You're tapping into those brain waves of relaxation. So any positive affirmations, visualization, meditation, or prayer that you do is really effective.
Very nice.
Yeah, 'cause your body's very open.
Yeah, there you go. Well, this was really, I learned a lot. I think acupuncture is something for me now that I might look more into. I think, and that's good. You're talking to the old fuddy-duddy MD. I know, look at Dr. Chris was falling asleep over here. Thank you so
still
much
with
for
you,
coming
Dr.
on
Mike.
today.
My pleasure.
Now,
Thanks for having me.
website, is there a place people can go and learn about you and see your clinic?
Yes, I'm actually offering telehealth and wellness services. My main website is drdrgamliel.com. And I also have an office here in Hollywood, Florida. So I give acupuncture treatments there.
Awesome. That is great. Thank you so much for coming on and teaching us so much.
Thank you so much for having me. It was a pleasure.
Don't forget, we go live every Wednesday at noon Eastern Time. I don't know if we're going to keep doing this all the time, but
I know, but this is great.
We do like the demos. You kind of look funny.
I'm happy.
We do like the demos. So don't forget to like and share and comment and make sure you let your friends know about the show. Again, that's 12 noon Eastern Time every Wednesday. I'm Dr. Mike. Thanks for watching.